Yeah.
This meeting is being recorded.
We do have a firm 24/7 launch date. So August 29th is going to be when we go 24/7. And that will be both available through our crisis line as well as through 988. So I think in terms of kind of like community engagement updates after conversation last time, so Patty connected us with oh shoot, I can't remember her name, no, the Reverend. So we're gonna meet with them for the Interfaith Council coming up in a while here. They're gonna get back to us when they have space. And then Kristen reached out about joining the event at the park. So we're gonna be there as well to kind of get the word out to people. Yeah, Katie, any updates that I'm missing from our end?
I don't think so. It sounds pretty comprehensive to me.
Could you talk a little bit about the kind of people that you've been responding to and helping?
Yeah, so we actually are about to release kind of like a quarter end summary report that goes in depth into that, but I can pull that up right now and just read off some from it. So over the most recent quarter, so from April to the end of June, we got 325 calls for response. Of the people that we provided mobile response for, 40% were uninsured and 31% were homeless. I think that 31% number is actually low just based on how we're able to report on that from our system. But so pretty significant percent of people are uninsured or homeless. We moved forward with involuntary hospitalizations on 16 occasions out of that 325 and had to do co-response or call 911 on 12 occasions. Evanston comprised 38% of all of our calls. So I think probably pretty proportional to the geographic and population. In terms of referral sources, very evenly split between like community organizations, community members, police, family, and then self being the most significant. For Evanston, we saw a fair number of school referrals as well, mainly from District 65, from the social workers over there. In terms of reasons for referral, about a third were for people experiencing psychosis or mania, about 15% for people with severe depression or suicidal ideation, 6% domestic violence, 22% resource connection, 11% substance use, 11% trauma, and about 3% just a wellness check. And then obviously, like, you know, many people present with multiple of those. We kind of just categorize based on what seemed the most pressing. So that's kind of like some basic summary info for the last quarter.
Yeah, very interesting. Any comments or questions from the committee? So I was interested that the number of calls that came through District 65. That's I don't think we were expecting that.
Yeah, so we they've been referring people usually when there's sort of like a home component in addition to what the child's going through. So maybe situations where SAS isn't able to get as involved with the family, or where like on one occasion, someone who was undocumented, so SAS wasn't able to work with them. So we're definitely, for the schools, still kind of secondary to SAS, but sort of filling in, as needed.
Yeah, wow.
Chris, can you tell me again the percentage of calls that came from Evanston?
Yeah, it was 38%.
Okay, that's what I wrote down. But so Are those specific calls broke down any further as to, category?
No, so each different category we just broke
Yeah.
down as a whole. We didn't
Okay.
further parse out Evanston.
Okay, all right, thank you.
And you're feeling good about the level of staffing that you have and to respond?
I mean, we're doing our best.
Right, sure.
Yeah.
Yeah.
I think we haven't run into any situations where response time has lengthened or where we haven't been able to respond. So we feel like we're doing well. I mean, it's definitely a concern, definitely, as we look forward to and like use of the line increases and everything. So
Yeah.
as we split shifts, that will also be a component as well, because right now the people who are on night shift are working days until we start that. So we've got sort of extra cushion of support. So
Right, yeah.
from a staffing perspective, really the hardest thing is just that almost no one has capacity for services after the crisis episode. So it's like we're needing to work with people for longer than we really can or intend to. So I think that's kind of been the biggest barrier. And yeah.
So is that something that the living room will help with when we finally get that going? Or is it more needing more therapists or what's the need?
Yeah, really more like team-based care, assertive community treatment, and community support teams. So like the really high level of care of intensive case management and like multidisciplinary teams for people with sort of the highest level of need. Definitely like therapy and psychiatry as well, but I think secondary to really that like intensive case management. I think the living room will help in that like it's a place that people can walk into when they're in crisis or for like case management. I don't think it'll make a significant difference just because it's really like that longer term care that is lacking, and they engage with people on a similar timeline as we do.
Got it. Yeah, Patty.
Yeah, can I pop in real quick?
Sure.
So Chris, when you say, that they really need more like intensive ACT, if we had capacity to take some folks, is that something that we could connect with you on? I mean, we don't have ACT teams, but we certainly have clinicians that, we've got some space. So I could connect offline with you and see if that's something that makes sense for some referrals.
Absolutely. Yeah, thank you.
Okay.
And we've connected a few people, so that would be great. Yeah, to check in and make sure we're not we're trying not to overburden any one agency or anything. So.
Okay. Yeah, good. I just wanted to make sure you knew that, we're not ACT. We're just, so, okay. Yeah. I'll connect you. Thanks.
And thinking ahead to the Friday in the Park event, is that, so there'll be one of the responders will be there to talk about how the program's working, or what do you envision in that community setting?
Yeah, so we'll have a few people there. We actually, Kristen, we didn't talk about this yet, but would we have kind of like a table where we could set up sort of brochures for people, and we've got like some agency materials and stuff?
Yeah, I think, right when you walk into Mason, which obviously there's kind of multiple different entrances, but if you're right outside the actual like building in that little circular area there, I've told them, and historically we've also had different resource tables out there. And so we'll make sure that there'll be a table that you can put any of that on. But I would also recommend, and I'll be there too. So I'll definitely help find whoever is over there and can help in any way that I can. But I think it would also be helpful because people do come in at different areas of the park. Some people don't even like make their way over there. So if you have a couple people there and someone can be at the table, I think it would be helpful to kind of walk around and mingle, right? There's people all over. I do think they're going to do a movie as a part of it on the August one. And so there'll be people before the movie starts, like kind of sitting out in the lawn chairs out there. And so it's up to you all, but I think it would be helpful to, yes, set up a table and have brochures, but also if people are willing to just, and I'll walk around with anybody too, mingle and, kind of talk to community members and just let them know why you're there and maybe be able to hand out some stuff. I think that's how you're going to reach the most people, I think.
Yeah, that sounds good. We were also going to print some of the 988 materials to also present for people. So, and kind of just frame it as like, these are two ways to access us, no one better or worse, and kind of point towards 988. Like if you're mainly looking for someone to talk to, 988 is probably a better way to go. And if you know that you really need in-person support immediately, it's probably better just to call us directly rather than to go through the whole process of 988 referring you.
Yeah, I think that'll be really helpful because the feedback that I've gotten so far with clients and things like that, just asking, and it is actually very well laid out on what you sent us, Chris, like the difference between 988, 311, 911, all of that. But a lot of people aren't outside, I think, agencies getting that information. And so we've been talking to clients and stuff just about the difference, right, between this and when you need this, where to call and all of that. And so I just think that will be huge at a meeting like, or at a, event like that where you have a lot of community members, just to be able to even decipher kind of what's what. Because I think it can get really confusing because it's all great things, but it's somewhat newer and it's kind of like what's what. I just think that would be really helpful.
Yeah. I think we are starting to hear about some like misinformation and stuff too around that. So like one of our crisis counselors told me this morning that someone on social media she saw was saying that if you call 988, a police officer always comes out, which is very much not the case. So.
Yeah, I think, the education is so important.
Yeah. Well, our EPD just a couple of days ago sent a press release talking about the 988 number. So that may have contributed to the confusion, maybe, I don't know, but yeah. So Cicely was going to be with us today, but she's buried at work and she was going to report on, she's been talking with one of the Evanston staff members about putting together little video that would explain the program and the difference between the different numbers and everything. So that's, kind of in the works, and we'll hear more from Cicely at our next meeting, I guess. Angela, do you have any questions or thoughts?
Well, it's just, this is what we've been anticipating, was that we need to get the word out about what is this thing that we're offering and who should access it, how do they access it, all of that. I am seeing it, it's popped up in my email in various ways, it's popped up on social media in various ways, so it's good to see that the word is starting to get out there, but definitely any high profile events that we have with community focused events, it would be great to have the booth like you're talking about doing. As much as we can do that, have flyers out. If there are, ways that we can circulate that more, we just want to make sure that everybody gets the accurate information so that they get the help that they need.
Right, yeah. Well, I think once we put together sort of an Evanston flyer or whatever, and we can ask all the members of the city council to send it out in a newsletter and start reaching out, into the different parts of the community. I noticed that Councilmember Burns is with us today because he wanted an update on the program. I don't know, Bobby, do you have any thoughts or comments at this point, if you're listening?
Just some general thoughts about, I think what stays in my mind is that I think as a city, what we're trying to achieve is eventually a true kind of alternative to 911. And so I always just go back to response times and how long things take to happen. Especially I was in a roll call with our police department. I asked them how much confidence they had in this program. They're like, yeah, it's all right, but there still was this idea that they would be expected to respond to these to much more urgent calls because they can get there quicker.
Mhm.
And so I just think about, I thought the 988 was going to be a quicker path to getting the word out and getting people, to respond to different calls. I came on, I think, a bit late, so I don't know if that's not the case or, I heard that we still may want to send people, have people call this other number and not dial 988. So I have some questions about that. But Chris, we'll connect offline, and I have a series of questions, but I don't want to take up time in the meeting. But I am happy that we have 988. Please send me that report as well.
Yeah.
James, I loved your question. I'd love to see if we could get the data, just the Evanston data, broken up in some of those same categories. That would be really helpful if it's possible. Is that possible, Chris?
To be very upfront, I don't know just time wise to redo that all again. But definitely like going forward, future quarters, we could potentially do that. So
Okay, that's all, Chair. Thank you.
Yeah. I mean, my understanding is that for people who really do want an immediate in-person response, and what I think have really envisioned as the alternative 911 response program really is through Trilogy. And the 988 number is going to be somebody to talk to, which is, super important in a, suicide crisis kind of situation. But I think we're just really so pleased that Trilogy is put together this really robust crisis response program, because I really think that's what we have been envisioning headed towards for the whole time that we've been meeting.
And I guess the last question is because I thought the 988 was going to be an option if we didn't figure out how to route calls that the police department gets directly to Trilogy. But now with this update, it sounds like we still need to figure out how to do that in order for this to become truly alternative to 911.
That's something that's going to be decided by the EMS regions. So like part of the CESA bill that was released is that each specific EMS region has to decide on that protocol for how 911 calls will be directly diverted to the crisis agency. So each EMS region, the Evanston EMS region includes Evanston and then going north, so up to like Highland Park or so. So they're also considering making sub-regions because like, there are obviously that's a big area and, different needs and stuff. But so Evanston, like city staff, like staff from Trilogy, and then St. Francis EMS region staff will kind of sit on that committee and develop those protocols that then also have to be run by the vendors that provide like the 911 call taker software. I don't know if that's the official terminology, but they have like very specific prompts that they use. And so we'll provide them with our protocol and then they'll integrate it into their system so that we can like have a seamless way of them dispatching us when 911 is called. So the EMS regions are required to make a report by the end of 2022 on how they want to do that. We'll see if that happens. That's a pretty short timetable. They haven't even like officially confirmed who is sitting on the region committees, but so it's really like 3 different ways of accessing the same thing, Councilmember Burns. It's like you can call 911, you may get diverted to us. You can call 988 and they can call us if a mobile response is needed, and you can also continue to call us directly. We wanted to keep our direct line up just so that people could access us in case it was, there may be long waits to call 988 and stuff. So,
yeah, right.
Is just last question. How can we help that committee? It seems like the committee needs to convene, and then just how can we help? Because I'd love to support in any way and help provide any level of advocacy that you think is needed at this stage.
Yeah, we can follow up when we learn more. So that's all being organized by the Division of Mental Health and IDPH, which oversees like EMS. So we're kind of just waiting for communication from them on who's named to those and what that would look like when they get started. But we can definitely loop you back in. We had provided there was like a form to nominate someone to be a part of the committee. So we provided that to Mayor Biss and then to the police department as well. And then we signed up as well. So hoping those different groups all, participate. So there were very specific criteria for who could participate. You had to be like with EMS, with like city government, or with a crisis agency for the most part.
That's all, Chair. Thank you. Thank you, Chris. Thank you, Chair. Appreciate it.
So Trilogy is getting some calls from our 911 dispatch people, right? So
yeah, police call us.
okay.
It's a little different than sort of how it will eventually look because it's not just a direct transfer. I think part of the thing too is they usually call us after they've already arrived on the scene. So part of the feedback around response time is like, well, why aren't you calling us when you get the call? Because like with CPD, like there have been cases where we get there before police. That's feedback we were going to give because then it's going to increase their time if they don't call us until they get there.
Right. Yeah. Well, we'll get all this worked out eventually. Yeah. Any other questions or things we should be thinking about? Yes, Angela.
Well, just on that, I'm just thinking like, our goal was for the crisis team to be the first call, not the second call. It's like,
Right.
And then they call the police if they need the police, rather than it sounds like it's happening the opposite of what our goal is. And of course, anytime there's a new program, it takes a little while for things to get rolling. But I think just if we keep our eye on the prize of trying to get it so that when it should be in one realm, that's the first call instead of it going to the other realm first and then evaluating.
Yeah, right. Yeah. No, it may be, some kind of training or extra attention to the 911 dispatch folks to make sure they're comfortable identifying the kinds of calls that could be sent, go right to Trilogy. So we'll work on that. I think Cicely's going to send me an email later, maybe with a little update, and I'll try to make sure to send it around to all of you. And I'd like us to try to meet maybe in early August to sort of keep pushing on the community education piece and see what we've been able to do, what Cicely's been able to accomplish in terms of a little video, but also just actually making sure we've got the kind of materials we need to be sharing and distributing through our various networks. So let me just grab a calendar. Okay. We could meet in 3 weeks' time, which would be Tuesday, August 9th. At our usual time, if that's, and we'll try to see if we can have some materials to be distributing beforehand so people can see how we're doing, see what more materials are needed and things like that. Does that sound good? Okay. Yep. Go ahead, Angela.
Yeah. Any materials that we do feel are ready to go, I'm happy to get those out through like the Chamber of Commerce and Downtown Evanston and, Women's Club and all those channels I just don't want to send out anything that isn't like Evanston ready just yet.
Right. Yeah. Because we do have something that's pretty Trilogy specific, right? About without the 988 number. Didn't Christy, you sent us?
Yeah, there's a flyer, and then we'll have 2 more pieces coming. One more of like a brochure with a very specific service list of what we can provide when we come out.
Hmm.
And then one that like summarizes some of that like community report back data that I read off to you. So in case people are interested and just for like transparency. So.
Mhm. Yeah. Yeah, so I don't know, Angela, if any of that would be the type of thing to share with the chamber, but or are you waiting for something that's really Evanston specific?
It doesn't, I mean, if it doesn't have to be Evanston specific, I suppose, as long as we, you know, it's what we're offering, we want to send out, maybe having it, you know, the 988 info and the Trilogy info going out together makes sense so that people can see the difference between the two, or, you know, because all of it's coming around at the same time.
Right, yeah, okay. Right, well, I'll work with Cicely to see if we can't get something, the handout piece, because I imagine the video piece will take a little longer.
Right,
Yeah. And then, so when is the first Friday? You'll be doing that August 5th, is that right, Chris? Okay, so then we'll have a report on how that goes at our meeting as well. Right. Great. Okay, well, thanks everybody, and stay in touch in between time if you've got questions or need more information. And but it's really exciting to see all this coming together. So really appreciate everybody's help. So great. Okay, thank you.
Thank you, everybody. Have a great day.